Prime Minister Justin Trudeau says new modelling shows public health measures are working to slow the spread of COVID-19. But he did warn that easing restrictions too quickly could wipe out the progress that's been made. Meanwhile, members of Parliament reconvened today for the first ever virtual meeting. The session was held on the video conferencing platform Zoom. For a look at both of these stories, I'm joined now by the CBC's Evan Dyer from his home in Chelsea, Quebec, and Eric Grenier in Ottawa. So, Eric, let's start with you. We got some new modelling numbers from the federal government. What stood out for you?
Well, I think the overall message from the modelling was that the public health measures that have been in place for the last few weeks have been working, that it's been slowing the rate of growth. It's not clear yet which side of the curve that we're on, if we're past the peak or not. But I think that was the overarching messaging that the modelling was able to show. A couple things that are kind of interesting from it, Dr. Tam said that at the beginning of the pandemic here in Canada, before the public health measures were in place, on average about 2.2 people were being infected by an infected person. So that means that every time someone got sick, they were giving it to, on average, at least 2 other people. And that's how you can get that exponential growth. She said now the infection rate is just over 1. The ideal is to get it below 1 because at that point the disease starts to peter out. The numbers suggested that by May 5th there should be between 3,300 and 3,900 deaths in the country, which is still a big number. We're below 3,000 right now. But the overall message was that the public health measures have been working and that they have to remain in place for some time to avoid another spike later on in the summer, later on in the fall. And also, we've heard this from the Prime Minister as well as public health officials, that we still do have an influence on the outcome here, that if we continue to do the physical distancing and other things like that, that we can continue to get that curve flattened and heading downwards.
Okay, let's bring Evan in now. There's another big story out of Ottawa, and most of Canada's MPs had a virtual sitting. It was kind of fun to watch.
It was kind of an interesting session. It was actually, there was a practice run yesterday just to test out the technology, Zoom, which so many people have become familiar with during this pandemic. It did work, more or less, with some minor glitches. I think people can imagine a Zoom meeting with 300 people on it, which is what we had today. There were people who had trouble connecting and who had poor signal and were locked out, and then went on Twitter to complain about that. There were other people who were being told to mute their phones and so on. But it did seem to function. And what we've seen now is a kind of a strange reversal of Parliament, because what met today, although it was, the great majority of Canadian MPs, was actually a committee. Normally, all of Parliament is 338 MPs, or however many show up on a given day. Committees usually have about 20 people or fewer. What we saw today, though, was a committee, technically, with all of Parliament showing up. Tomorrow, we'll see a real sitting of Parliament, perhaps with only about 20 people showing up. So it's a reversal. But today's hearing was technically held as a committee hearing, a committee of the whole kind of, because that limits what can be done. And there are parties that don't want to see these virtual sittings become a place where the government can make announcements or introduce government bills. But tomorrow we will see a real sitting, actual live bodies showing up on the Hill, and at that point the government will be able to introduce that kind of business.
Eric, today Dr. Teresa Tam was talking about the revised projections and how they reflect the heavy toll that COVID-19 is having on vulnerable populations. Dive a bit into that for us.
Yeah, that's one of the things that's been behind some of the errors, you could say, in the modelling, that there's been many more deaths than expected. It's because of the outbreaks that we've seen in long-term care facilities and seniors' homes. Dr. Tam said that 79% of deaths that have taken place have been in these centres. So that just shows how these are the most vulnerable people that there could be, and they are catching this, and unfortunately many of them are dying. But she also highlighted prisons, homeless shelters, group homes, places where there's vulnerable people living close together. This is where we're seeing these outbreaks. She also mentioned how 74% of all hospitalizations, there are people who have underlying conditions. So it does show that it's primarily the vulnerable that are getting this and getting very severe cases of it, though when you talk about 74%, you're still talking about, a quarter of those cases in hospitals where they didn't have underlying conditions. And you do see that the median age of someone with COVID-19 is 52. So while most of the people who are dying are older, people from all ages are actually getting the disease.
Evan, Eric was talking earlier that both Dr. Tam and the Prime Minister were warning that if we act too fast, we could lose this progress that's been made. So why are some provinces like Quebec already working on plans to ease up on restrictions as early as next week?
Well, we heard some justification of that from the Premier of Quebec today, Francois Legault, and his Minister of Economy, Pierre Fitzgibbon. Arguing, for example, with the schools that children are suffering, particularly children with learning disabilities and so on, can't be 6 months out of school. He's talking here about elementary school children. That businesses are suffering and that businesses want to come back. But we also did hear something that Eric was just talking about, which is the notion in Quebec, which is really the only province that has a timetable with actual dates on it. The notion that while there have been a lot of deaths, there have been a lot of infections, that they're localized, localized regionally, focused heavily around the island of Montreal, but even more importantly, that they're inside certain kinds of institutions, long-term care facilities and seniors' homes specifically. Outside of those settings and outside of that region, the problem is less severe. So Quebec is not saying, full speed ahead on all cylinders in all areas. It is trying to have a sort of a staged reopening, putting the emphasis on caution, saying that we're going to monitor what happens, and if we see a new outbreak, we will quickly dial things back in terms of reopening. And that is not so at odds with what federal officials are saying or what other provinces are saying. They're all in agreement, more or less, on the nature of reopening. I think where we see the disagreements is not on the principles behind reopening, but rather where are we right now in that stage. And an example of that was when we saw the Premier of Quebec justifying reopening schools. We then saw very shortly afterwards Premier Doug Ford of Ontario, also someone who said he wants to reopen, but when asked about schools, he said, I wouldn't put kids at risk. So pretty clearly, there are still some differences in spite of this broad understanding between the premiers and the federal government about the principles of reopening.
Yeah, and Eric, how does Canada fare when it compared to other countries?
Well, the modeling that was presented today suggests that Canada was doing pretty well compared to a lot of the other countries, that we are quite a bit behind some of those other countries, in some cases 2 to 3, 4 weeks, which is an advantage. It does mean that we get to learn how they are handling the disease, how they're handling reopening the economies. So we do get to learn some lessons from that. It is hard to compare how Canada is doing to other countries, though, because it does rely a lot on how countries are testing, how much testing is taking place, how they're reporting deaths, things like that. So it is hard to make those comparisons, but it does seem that Canada is doing moderately well, though not as well as some other cases, for sure.
Yeah, and Evan, just quickly, there will be some federal framework in this as well.
That's right. Although we did see today Prime Minister Trudeau saying he recognizes that there are great regional disparities. For example, no community transmission at all in the territories, more than half of all cases and deaths in Canada in one province, Quebec. So they're obviously different situations. And he said the role of the federal government will not be to dictate to individual jurisdictions how they should do these things, but to make sure that they have the supplies to be able to do it. For example, test kits, the ability to trace new cases and to jump on top of these infections. But there were also some general principles laid out about what should open first and what should open last. And one of the things that the federal government did make clear today was that it considers a reopening of Canada's borders to be something that would probably only happen in the latter stages of this pandemic, because whatever happens in Canada, it's likely to remain out of control in some other parts of the world.
Evan Dyer in Chelsea, Quebec, and Eric Grenier in Ottawa, thank you for breaking this down for us.
Thanks, Evan.